Welcome, everyone. Today we're equipping ourselves with knowledge about one of the most infamous viruses on the planet. I mean, when we hear the word Ebola, it's so easy for our minds to immediately jump straight to fear or those dramatic Hollywood movies. But in this explainer, we're going to replace that fear with pure, empowering scientific understanding. We're going to look at what actually happens inside the body, how modern medicine fights back, and what the real journey looks like for patients. Okay, let's dive into this.
So here's our clinical roadmap for today. We'll cover the reality of Ebola, transmission and infection, symptoms and the disease course, diagnosis and modern treatments, and finally, the road to recovery. And hey, we're not going to oversimplify this because you deserve the real clinical facts.
All right, Section 1, the reality of Ebola.
Let's just strip away all that sensationalism and look at what the medical community has actually learned from decades of studying this pathogen.
To really wrap our heads around this, we have to bust a massive misconception right out of the gate. For the longest time, you probably heard this called Ebola hemorrhagic fever. And honestly, that name just conjures up these terrifying images of catastrophic bleeding, right? But the medical community actually changed the name to Ebola virus disease. So why the switch? Well, case series showed that major hemorrhage actually isn't found in most patients. And when it does happen, it's usually only in the very late stages. The true clinical threat, the thing that actually makes patients so incredibly sick early on, is profound fluid volume loss from vomiting and diarrhea. Changing the name completely shifts how we understand the very nature of the threat.
The threat itself isn't just a single entity either. The invader belongs to a genus called ortho-ebolavirus. There are actually 6 distinct species out there, but only 4 of them, Zaire, Sudan, Bundibugo, and Thai forest, are known to cause disease in humans. The Zaire species, which is the one most people just call Ebola virus, has been responsible for the largest outbreaks. And this brilliantly illustrates that not all Ebola viruses are exactly the same. As we learn how to fight them, we really have to keep all these different viral cousins in mind.
Moving on to Section 2, transmission and infection. Exactly how does this virus move and actually invade a human host? The actual mechanics of transmission are very specific, and honestly, understanding this is one of the most empowering things you can learn today. Ebola is not an airborne virus like the flu or COVID-19. You absolutely do not catch it just by breathing the same air in a grocery store. It requires direct physical contact with the bodily fluids of an infected person, whether they're living or deceased. That means blood, sweat, feces, vomit, or saliva. The virus then has to find a way in through broken skin or unprotected new membranes, like your eyes, nose, or mouth. These epidemics almost always start when a human comes into contact with an infected animal reservoir, and the evidence heavily points to bats. But once it jumps to a human, it's that direct fluid-to-fluid contact that really drives the spread.
Now, what's really interesting about this slide is how strictly public health officials define a high-risk exposure. It's definitely not about casual passing contact. High risk involves things like a percutaneous injury, like a needle stick, or unprotected mucous membrane exposure while giving care to someone who is sick. This is exactly why strict infection control protocols, like the rigorous use of personal protective equipment, are so incredibly effective at stopping the virus right in its tracks.
Okay, Section 3, symptoms and disease course. Let's talk about what happens on the clinical battleground inside the body once the virus actually makes it past our defenses.
Let's walk through the chronological journey of the disease. After exposure at day 0, there's a silent incubation period. It typically lasts 6 to 12 days, though it can range anywhere from 2 to 21. And during this time, the patient is completely non-infectious. But then, the onset is incredibly abrupt. Week 1 hits with sudden fever, severe fatigue, headache, and massive gastrointestinal symptoms. A diffused rash might also pop up. Then we reach a really critical turning point. Week 2. This is basically the fork in the road. Patients will either begin to show signs of clinical improvement or the disease will progress rapidly to hypotension, shock, and multi-organ failure.
To understand why those symptoms get so severe, we have to look at what the virus is doing down on a cellular level. It's like a hijacked security system. The virus actively targets ubiquitous sentinel cells in our immune system, particularly macrophages and dendritic cells. The virus replicates inside them, causing the cells to die, a destructive process called necrosis. And as these cells burst open, they release a massive storm of pro-inflammatory cytokines. So the body's own systemic inflammatory response, combined with direct tissue damage to organs like the liver and spleen, is what actually drives the devastating symptoms we see on the outside.
And that brings us to a frankly staggering number, 10 liters. That is the amount of watery diarrhea a patient with Ebola disease can lose in a single day during the acute gastrointestinal phase. I just want you to visualize that volume for a second.
It's a massive amount of fluid. It completely frames why severe dehydration, a dangerous drop in blood pressure, and hypovolemic shock are the immediate life-threatening dangers facing the patient, way more so than bleeding. Because you aren't just losing water here, you're literally losing the vital electrical charge of your body. This massive fluid loss leads to incredibly dangerous electrolyte abnormalities, specifically plummeting levels of sodium and potassium, what we call hyponatremia and hypokalemia. And here's why this matters. If doctors don't aggressively replace these electrolytes, these imbalances can trigger fatal cardiac arrhythmias. The heart simply cannot maintain its rhythm without them.
Now for Section 4, Diagnosis and Modern Treatments. Let's shift our focus away from the virus's attack and talk about the stabilizing, life-saving force of our modern medical defense.
Obviously, before you can treat, you must confidently diagnose. And doctors follow a really rigorous, logical process to do this safely. First, they assess the clinical signs alongside a strict 21-day travel or exposure history. If there's any risk, the patient is immediately and safely isolated. Then, they run an RT-PCR blood test which specifically hunts for the virus's RNA. But timing is absolutely everything here. The virus is generally detectable within 3 days of symptom onset. If a patient gets tested earlier than 72 hours after their symptoms started, and that test is negative, doctors actually have to retest them later just to definitively rule the disease out. Once confirmed, the medical team launches a fierce, two-pronged counterattack. The first prong is aggressive supportive care, relentlessly replacing those lost intravenous fluids and electrolytes to prevent shock. The second prong is a massive leap forward in science, specific therapeutics. We now have FDA-approved monoclonal antibodies like REGN-EB3 and MAB114 that specifically target the virus and have been proven in clinical trials to drastically improve survival. We can even offer things like renal replacement therapy or dialysis if the kidneys start to fail. So the crucial point is that survival rates have drastically improved in recent years. We are absolutely no longer defenseless. The clinical recommendations validate this optimistic shift, emphasizing that early diagnosis and the prompt initiation of this specialized care directly increase the likelihood of survival. Getting a patient into an Ebola treatment unit where they can get those vital IV fluids and these incredible targeted monoclonal antibodies is the absolute most important factor in saving their life.
But surviving the acute infection is really only part of the battle. Which brings us to Section 5. The road to recovery, and what life looks like after the infection.
Let's move to and see how this builds into a phase known as convalescence. Medical science is now fully recognizing that recovery for Ebola survivors is incredibly prolonged. We're talking a process that can persist for more than 2 years. It's a deeply difficult and often totally invisible aftermath, where patients face a whole host of lingering physical and psychological symptoms that can severely interfere with returning to their normal everyday lives.
Survivors bravely navigate a really complex web of lingering effects. Musculoskeletally, they often deal with severe weakness and incredibly debilitating muscle and joint pain. Neurologically and ocularly, they can suffer from memory loss, hearing issues, and a painful eye inflammation called uveitis. Then there's the psychological toll. The sheer trauma of the disease, combined with intense social stigma, leads to high rates of depression, anxiety, and PTSD. And perhaps most wild of all, the virus can actually persist, hiding out in immunologically privileged sites, like the central nervous system, the eyes, and the testes, long after it's been totally cleared from the blood. All of this means that survivors absolutely need compassionate, long-term, specialized follow-up care.
So we've journeyed from the terrifying realities of profound fluid loss, through the exact mechanisms of transmission, all the way to the incredible life-saving interventions of modern medicine and the really tough road of survivor recovery. We finally understand how to protect ourselves and how to fight back. So I'll leave you with this final provocative question to think about. With targeted monoclonal antibodies, highly effective vaccines, and advanced supportive care now firmly in our medical arsenal, are we finally ready to outsmart the next filovirus outbreak before it even begins? Thank you so much for joining me on this explainer. Keep learning, stay curious, and we'll see you next time.